Part 2 of the skeletal system and the continuation of axial skeleton. So this is the thoracic cage that we are going to study today. The thoracic cage or the rib cage that are consisting about 12 pairs of ribs, sternum, intercostal cartilage, intercostal muscles and the thoracic vertebrae. We know that the ribs are flat, curved, ribbon-shaped structures. A flat, ribbon-shaped and a curved structure that are attached anteriorly to the sternum, that is the breastbone, and posteriorly to the backbone or the vertebral column. Vertebral column spot like thoracic vertebral column, thoracic vertebrae. There are 12 pairs of ribs, 6 in both the sides, and together they make a cage-like structure to protect the internal organs like heart and lungs. There is intercostal muscles in between two ribs as well as intercostal cartilage in where the rib is joining to the sternum. In last class, we have learned that what the cartilage is, that is a soft bony structures. Later we will learn about that. Now, this cartilage, the presence of cartilage makes the facilitation of articulation of this rib to the sternum, as well as the cartilage, a piece of cartilage pad or this cartilage disc is present in between the vertebral bones, right? Let's see the structure of this thoracic cage. A cage-like structure that protects the vital internal organs located in the chest like heart and the lungs. Then the major blood vessels here. Let's see the parts of the ribs like the blue color marked portions are the bony structures or the ribs, and the yellow color parts are the costal cartilage that is actually articulating to the green colored part, that is the sternum, or it is called as a breastbone, located in the medial part of the chest. Let's see the parts of a typical rib. Anterior end of this rib is articulating with the costal cartilage. It has a shaft or the body of the rib. There is a head and neck posteriorly. Also, there is articular facet posteriorly to articulate with the vertebral disc, vertebral column. This is the structure of the sternum, anterior view of the sternum, otherwise it is called as the breastbone. It has mainly three parts. They are the manubrium, the body of the sternum, and the xiphoid process. You can see either side of this manubrium or upper part of the manubrium, there the costal cartilages of the first ribs are attached. The lower part of the manubrium, the body of the sternum, and the upper part of the xiphoid process consist of costal notches on either side, in which the ribs and the costal cartilage of the ribs are articulated. All the ribs are connected or attached or articulated with the backbone posteriorly. At the same time, all the ribs are not articulated to the sternum anteriorly. Only first 7 ribs are directly connected to the sternum through the costal cartilage. 8th, 9th and 10th ribs are indirectly connected to the 7th costal cartilage. But 11th and 12th ribs are only posteriorly connected to the backbone, but anteriorly they are not connected anywhere, hence they are called as floating ribs. Now the parts of axial skeleton is finished here. Let's start the appendicular skeleton now. That consists of pectoral girdle. Pectoral girdle consists of the bones like clavicle and scapula. Clavicle is the collarbone and scapula is the shoulder bone. Then the upper limb consists of humerus, radius, ulna, carpals, metacarpals and phalanges. Same like pelvic girdle that consists of the pelvis bone and the hip joint. Now the lower limb that consists of the femur, tibia, fibula, tarsals, metatarsals and phalanges. Let's see what are those things all. Let's see the structure of those things. Now, this is the pectoral girdle. The parts of the pectoral girdle is the clavicle or the collarbone and the scapula or the shoulder blade. The clavicle has mainly three parts: acromial end, the body of the clavicle or the shaft of the clavicle, and the sternal end. Acromial end joins with the acromial process of the scapula. At the same time, the sternal end joins with the manubrium of the sternum. This is the scapula. It is a triangle shaped bone. It has two bony projections on this on laterally. So they are called as acromial process and coracoid process, because that process is looking like the beak of the crow. So it is called as a coracoid process. Acromial process of the scapula and the acromial end of the clavicle joins together or articulate together and makes acromioclavicular joint. Superior view of the acromioclavicular joint. Scapula has a cavity called as glenoid cavity, in which head of the humerus is the upper arm bone. It has a bowl shaped head that is articulated with the glenoid cavity, hence it forms the humeroclinoid joint or the shoulder joint. Now you understand that the shoulder region has two joints. One is acromioclavicular joint and another one is humeroclinoid joint. In the anatomy, the bony protrusions on particular bone is called as a processes. So here is the acromial process and the coracoid process. They are the protruded or projected bony part of the scapula. The posterior view of the acromial process is here. Now let's see the upper limb that consists of a single bone in the upper arm called as humerus, and in the elbow joint the humerus joined with two long bones called as radius and ulna. Now after the radius and ulna there is a wrist, and in the wrist joint there are short bones. They are called as carpals. After that the palm is made up of the metacarpal bones and the fingers are made up of the phalanges. Now let's recall the phalangeal formula, that is counting the digits from medially, that means from the thumb, that is 2, 3, 3, 3, 3. Let's see the elbow joint. Humerus joins with the radius and ulna. The capitulum of the humerus joins with the radius and the trochlea of the humerus joins with the ulna. Here is the anterior and posterior view of the elbow joint. There are 8 carpal bones in each wrist of upper arm, and in both the hands totally 16 carpal bones are there. Then metacarpals are the 5 in numbers. They make the palm of the hand, and the phalanges are the bones that makes the digits or fingers of the bone. Here is the hip bone or the pelvis bone. 3 different bones join together to form this hip bone. They are ilium, ischium and pubis. Ilium is the upper or superior part of the pelvis bone. Ischium is the lower back portion of the pelvis bone on which our back rests when we are sitting. Pubis is the part of the pelvis bone medially. Pelvis bone laterally in the lower consists of a cavity called as acetabulum, in which the head of the femur is the thigh bone, and the bony bowl-like projection that is called as the head of the femur that is articulated. Thus it makes the hip joint. Here is the thigh bone, that is the largest bone in the body, longest bone also in the body called as the femur, and proximally it has a head and neck that articulates with the hip bone. At the same time distally it articulates with the tibia in the knee. Here is a knee joint. There is a small round small bone. It's called as patella or otherwise called as kneecap, that is connected to the femur anteriorly, but it does not have any relation to the knee joint. The knee joint is actually made up of the joint between the tibia and the femur. Below the knee joint there are 2 bones called tibia and fibula. Thick bone is the tibia and the thin bone, that is the fibula. Distally These two bones are joined as well as proximally also the same, the two bones are joined, thus forms tibiofibular joint proximally, called as proximal tibiofibular joint and distal tibiofibular joint. Now let's see the bones of the foot. There is tarsals similar to carpals in the wrist. Unlike 8 carpals, here is 7 tarsals in the ankle and 5 metatarsals in the foot and 14 phalanges in the digits of the leg. Let's see the names of the 7 tarsal bones. First one is calcaneus, talus, cuboid, navicular, medial cuneiform, lateral cuneiform and intermediate cuneiform bones.